When providing perineal care for a male resident, it is important to wash from front to back, pat dry with a towel, ensure privacy, and explain steps, all of the above. Correct answer is D. Providing perineal care requires washing from front to back to prevent spreading bacteria, patting dry with a towel, ensuring privacy for the resident, and explaining each step to promote dignity. Which of the following is not a sign of dehydration? Dry mouth, decreased urine output, increased thirst, increased appetite. Correct answer is D. Increased appetite is not a sign of dehydration. The other options, dry mouth, decreased urine output, and increased thirst, are all signs that the resident may be dehydrated. When doing range of motion exercises with a resident, it is important to move the joints quickly through the full range of motion, support the joints fully with one hand while moving with the other, go slowly, explaining each movement to the resident, none of the above. Correct answer is C. Range of motion exercises should be done slowly to prevent injury, explaining each movement to involve the resident and build trust. The joints should be fully supported through the movement. You discover a resident has soiled their brief with loose stools. When cleaning them, it is important to use baby wipes, washcloth and soap and water, alcohol swabs, paper towels. Correct answer is B. Loose stools should be cleaned with a washcloth and soap and water for proper sanitation. Baby wipes, alcohol swabs, and paper towels do not sufficiently clean stool from skin. When a resident does not want to take their medication, the best approach is to insist they take it and remind them the nurse said to, ask what concerns they have and address them empathetically, tell the family to ensure they take future doses, offer a bribe like dessert to take the medication. Correct answer is B. The best approach is to have an empathetic discussion to understand concerns and address them, respecting resident autonomy and preferences. Insisting, involving family without consent or bribery are not respectful approaches. Which of the following ways can help prevent pressure ulcers? Keeping the skin clean and dry, repositioning every 2 hours for those unable to do so, using skin protectant on bony areas, all of the above. Correct answer is D. All of the listed options are important measures to prevent pressure ulcers, keeping skin clean and dry, regular repositioning, especially for those with limited mobility, and applying a skin protectant to bony prominence areas. When giving a bed bath, it is important to cover the resident with a blanket, towel, sheet, all of the above. Correct answer is D. For warmth and dignity while bathing a resident in bed, it's best to cover them alternately with a sheet, towel, and blanket, as areas are washed to keep them covered at all times. A nursing aide enters information about a resident's care into the progress notes, care plan, medication administration record, all of the above. Correct answer is D. A nursing aide would document relevant information about all aspects of a resident's care, including how they provided care, the resident's responses and condition into progress notes, care plan, and MAR as applicable. When providing perineal care for an incontinent resident, the nursing aide should perform hand hygiene before and after care, during care if hands get soiled, only after completing care. Hand hygiene is not needed. Correct answer is B. Hand hygiene should be performed before care, during if hands contact body fluids, and after, to follow standard precautions and prevent spread of infections. An example of passive range of motion exercises is bending and straightening the elbow, raising and lowering the straightened leg, rotating the ankle, all of the above. Correct answer is D. Passive range of motion involves moving the resident's joints through their range without active effort from the resident. All the listed examples are types of passive range of motion exercises. To avoid injury, how should a resident be turned for repositioning? Quickly rolled to the other side, lifted and lowered facing up, pulled by their legs or arms, log rolled on their side. Correct answer is D. To prevent injury, residents should be log rolled onto their side to change positions for repositioning, rather than being quickly rolled, lifted by limbs or facing up. When supporting a dependent resident in a standing transfer, the nursing aide should stand in front facing them, behind them with arms around their waist, to the side for better leverage, kneeling to better reach resident. Correct answer is B. For safety, the nursing aide supports a dependent resident needing assistance to stand from behind with arms around their waist for a more controlled, balanced transfer. A nursing aide is educating the resident's family about preventing pressure ulcers. Which approach is most effective? Giving them a pamphlet to read, having a one-way conversation telling them tips, engaging them in a two-way discussion and answering questions, emailing them the information. Correct answer is C. An interactive two-way discussion allows the family to actively participate, have their questions addressed, and reinforce their understanding compared to a one-directional conversation, pamphlet, or email alone. When caring for a resident who is confused, it is important for the nursing aide to raise their voice to ensure they understand, simplify instructions, and maintain eye contact. Assume they don't understand and do the care themselves. Try to quickly complete the care despite confusion. Correct answer is B. For a resident experiencing confusion, the aide should simplify instructions, maintain eye contact, and ensure understanding rather than yelling, doing the care without involving the resident or rushing through care. What is the first step in the hand washing process according to CDC guidelines? Rinse hands with water, apply soap to hands, scrub hands for at least 20 seconds, dry hands with paper towel. Correct answer is B. The correct hand washing sequence is to apply soap, scrub for 20 seconds, rinse, then dry with a paper towel. When assisting a resident to dress, it is important the nursing aide gently stretches fabrics to prevent wrinkles before dressing, allows the resident to dress as much as they can independently, dresses the resident as quickly as possible, focuses on efficient dressing over the resident's dignity and privacy. Correct answer is B. The goal in assisting with dressing is to promote the resident's independence, dignity, and privacy, rather than speed, preventing wrinkles, or fully dressing them. When providing perineal care to a female resident, the aide should wash from front to back to front. Either direction is acceptable, around the genital area only. Correct answer is A. To prevent spreading bacteria, perineal care for females should always be done washing from front to back. How should soiled linens be handled? Rinsed and hung to dry, taken directly to the laundry room, stored in a designated bin until laundered, placed in the resident's room garbage. Correct answer is C. Soiled linens should be placed directly into a designated leak-proof linen bin for transport to the laundry rather than being rinsed, hung, or placed in garbage to prevent the spread of infections. When ambulating a resident with a walker, it's most important the nursing aide keeps the resident moving fast to build endurance, walks slightly behind and to the side for safety, lets the resident self-pace and provide cues, walks in front to motivate the resident. Correct answer is C. For safety and to prevent falls, the aide should walk slightly behind and to one side of the resident using a walker, allowing them to self-pace and providing cues or assistance as needed, rather than pacing them or leading from the front. What is the OSHA mandated ratio for CNA to residents in a nursing home setting? 1:10 during the day, 1:20 at night, 1:8 at all times. Ratios are not set by OSHA. 1:6 during the day, 1:15 at night. Correct answer is C. OSHA does not set specific resident-to-staff ratios in long-term care facilities. Ratios may be defined by state regulations. When helping a resident who is experiencing back pain turn in bed, the nursing aide should twist the resident's torso to face the other direction, lift the top leg and roll the resident onto their side, log roll the resident by placing one hand behind their back and the other in front to maintain their spine alignment, quickly flip the resident's upper body over. Correct answer is C. To prevent further back pain, the resident should be log rolled onto their side to reposition, maintaining proper spine alignment rather than twisting, flipping, or improperly lifting parts of their body. The primary purpose of a feeding tube is for enjoyment of eating, providing medication, preventing aspiration, maintaining nutritional intake. Correct answer is D. While providing nutrition and preventing aspiration are also purposes, the primary reason a feeding tube is placed is to ensure the resident maintains adequate nutritional intake when unable to eat orally.